On the night of February 19, 1994, the emergency room at Riverside General Hospital, California, was running as usual, a mix of routine admissions and late-night emergencies. Around 8:15 p.m., the paramedics rushed in with a 31-year-old woman named Gloria Ramirez. She was conscious, but barely responsive. Her skin was pale, and she was struggling to breathe. Gloria was suffering from advanced cervical cancer, but something else was wrong that night, something that no one could explain. Within minutes of her arrival, multiple staff members inside that ER began to feel dizzy, nauseated, and faint. What should have been a normal resuscitation quickly turned into one of the strangest medical incidents ever recorded. When Gloria was wheeled into Trauma Room 1, Nurse Susan Kane started to draw blood from her arm. The staff immediately noticed an odd oily sheen covering her body. It looked like some kind of grease or lotion. Then came the smell. Several witnesses described it as a garlic-like odor mixed with a faint fruity metallic scent. As Susan passed the syringe to the resident doctor, Julie Gorczynski, she noticed something bizarre: crystals forming inside the blood sample. Clear, tiny particles floating in the tube. That shouldn't happen in fresh blood. Seconds later, Gorczynski began to feel lightheaded. Her face went pale. She complained of nausea, stumbled backward, and fainted. Another nurse, Maureen Welch, also collapsed. Within minutes, several staff members were on the floor. The emergency department was evacuated. Gloria Ramirez was left almost unattended on the bed as the rest of the hospital tried to make sense of what was happening. What could make a woman's body emit something so toxic that it incapacitated hospital workers just by being near her?
Let's go back to start.
Gloria Ramirez was a mother of two from Riverside, known to friends as kind and energetic. In late 1993, she was diagnosed with cervical cancer, terminal. By February 1994, her condition had worsened significantly. She was taking pain medication and had lost a lot of weight. When paramedics found her that evening, she was confused and gasping for air. They began CPR and rushed her to the ER. At Riverside General, doctors gave her Valium, Ativan, and Verse to calm her. They used lidocaine and beryllium to stabilize her heart. But nothing worked. Her blood pressure dropped rapidly. Despite all efforts, Gloria went into cardiac arrest. At 8:50 p.m., Gloria Ramirez was pronounced dead. But the nightmare was far from over. Outside the trauma room, several hospital staff were being treated for symptoms of fainting, nausea, and breathing difficulty. One medical resident even developed apnea, temporary loss of breathing. In total, 23 people became ill, and 6 required hospitalization. The hazmat team was called in. They sealed the emergency room and began collecting samples. The entire area was treated as a toxic contamination zone. The local health department and law enforcement got involved.
The media soon picked up the story, calling Gloria Ramirez toxic lady.
An investigation was launched immediately. What could possibly cause such an event? Initially, everyone assumed it was a chemical leak or toxic gas exposure. But nothing was found. The hospital's ventilation system was clean. No leaks. No spills. Next, suspicion turned toward Gloria's body itself. Her remains were sealed in a special airtight coffin, and the coroner's staff were ordered to wear protective suits. When they conducted the autopsy, they noticed something peculiar. There was a strong ammonia-like odor coming from her tissues. But they found no signs of poison or radiation. At this point, theories started flying everywhere. One of the first ideas was that Gloria might have used a home remedy involving toxic substances. People speculated she could have applied dimethyl sulfoxide, DMSO, a common industrial solvent sometimes used as a topical pain reliever. Back in the 1990s, DMSO had a reputation as a miracle pain cure, sold in some alternative medicine stores. It produces an oily film on the skin and gives off a garlic-like odor. That matched several things the staff described: the greasy texture, the smell, and even the strange crystals in her blood, since DMSO can crystallize when cooled. But could DMSO really make someone's body so toxic it sickened hospital staff? A few months later, a team of scientists from Lawrence Livermore National Laboratory was brought in to test this theory. Their report shocked everyone. They proposed that DMSO in Gloria's body could have chemically transformed after reacting with the oxygen being given to her in the ER. DMSO can oxidize into dimethyl sulfone, DMSO2, which explains the crystals found in her blood. But under certain conditions, DMSO2 might further convert into a highly toxic gas called dimethyl sulfate, DMSO4, known to cause respiratory collapse, nausea, and convulsions when inhaled, even in small amounts. If this reaction happened inside the hospital, it could explain why so many staff members were affected, but only those closest to Gloria. Still, not everyone accepted this explanation. Some experts argued the chemical conversion theory was highly unlikely under normal body temperature and hospital conditions. They pointed out that no trace of dimethyl sulfate was ever found in the samples taken from the ER or from Gloria's body. Others believed it was a case of mass hysteria, a psychological reaction triggered by stress. In other words, once one person fainted, others subconsciously followed. However, that didn't explain why several people had real measurable physical symptoms: liver damage, reduced white blood cell counts, and breathing problems. The most severe case was that of Dr. Julie Gorchinsky, the resident who had fainted early in the incident. She was hospitalized for 2 weeks, developed avascular necrosis in her knees, tissue death due to lack of blood supply, and took months to recover. Mass hysteria couldn't account for that. Meanwhile, Gloria's family demanded answers. They wanted to know why her body had been sealed away for weeks, why officials were refusing to release her remains, and why the reports were inconsistent. Her husband accused the hospital of mishandling her treatment. The coroner's office completed their investigation and finally listed cervical cancer as the cause of death, with toxic exposure under investigation. No criminal charges were filed. But the story didn't end there. The more scientists and investigators looked, the stranger the case became. Some suspected contamination during medical treatment, others suggested illicit chemical exposure before she arrived at the hospital. A few even whispered about government involvement, claiming the materials used on her body were experimental. Whatever the truth was, the mystery of Gloria Ramirez's toxic body became one of the most baffling and controversial medical cases in modern history. The hospital later changed its safety protocols, training staff on handling unexplained contamination incidents. The incident was written into toxicology textbooks, still referenced today as a medical mystery with no definitive answer. But behind all the reports and theories, there was still the human side, a dying woman in pain, just trying to survive her final days, unknowingly becoming the center of a case that would puzzle scientists for decades. And while Gloria Ramirez's official cause of death was cancer, what happened inside that trauma room remains unclear. The strange smell, the oily skin, the fainting staff, all real, all documented. But the cause? Still debated. In Part 2, we'll go deeper into the forensic investigation, the autopsy findings, and the final theories that tried to close this chilling mystery once and for all. After Gloria Ramirez's death, the Riverside County Coroner's Office took custody of her body. But even in death, she was treated as a potential biohazard. Her remains were placed in an airtight, sealed aluminum casket and stored in a special containment area for several days before anyone dared to perform an autopsy. The case had become national news by then. Journalists surrounded Riverside General Hospital, calling Gloria the toxic woman or the toxic lady of Riverside. Reporters wanted to know what kind of human could emit gases so poisonous that an entire emergency department had to be evacuated. The coroner's team finally began the autopsy on March 25, 1994, more than a month after her death. They used hazmat suits, gas masks, and negative pressure rooms to prevent any possible exposure. Despite all the precautions, the coroner's office staff immediately noticed the same odor described by the ER team, a sharp chemical-like smell that seemed to come from her tissues. When they opened her chest cavity, they noted that her internal organs were unusually decomposed, far more than expected for a body stored in controlled conditions. Yet, the toxicology results showed nothing extraordinary: no poisons, no drugs beyond what the hospital had administered, and no evidence of chemical warfare agents or radiation. It was as if whatever had caused the ER incident had vanished, leaving behind no physical trace. At this point, investigators were under intense public pressure to produce answers. Theories were flying in every direction. To understand what really happened, the California Department of Health and Human Services, CDHHS, assembled a scientific task force that interviewed everyone involved, from paramedics to ER doctors to the hazmat team. Out of 37 staff members in the ER that night, 23 reported symptoms, but only those who were within a few feet of Gloria developed severe effects. That pattern pointed to a localized chemical exposure rather than a contagious illness or radiation. The CDHHS ruled out mass hysteria, at least for the initial wave of victims. The first few people who collapsed were trained professionals with no history of anxiety disorders, and several had objective medical findings, such as elevated white cell counts and abnormal liver enzyme levels. Then came the Lawrence Livermore National Laboratory, LLNL report, the most cited explanation to this day. Their chemists analyzed the evidence and reconstructed a possible chain of reactions. They confirmed that Gloria had indeed been using dimethyl sulfoxide, DMSO, as a home remedy to ease her pain. The oily substance found on her skin matched it perfectly. When given oxygen therapy in the ER, the DMSO could have oxidized into dimethyl sulfone, DMSO2. Now, here's where things get complicated. LLNL theorized that the electric shocks from the defibrillator and the warm temperature of the room could have further transformed DMSO2 into dimethyl sulfate, DMSO4, a compound known to be extremely toxic. When inhaled, it can cause delirium, seizures, paralysis, and death. If even a small amount of this gas had formed in the ER, it could easily have caused the symptoms seen in the medical staff: fainting, shortness of breath, eye irritation, and nausea. It was a fascinating and horrifying theory. The transformation of an ordinary household chemical into a lethal gas, right inside a hospital. But not everyone was convinced. Other toxicologists challenged the LLNL conclusion, arguing that dimethyl sulfate cannot form at human body temperatures or under hospital conditions. They suggested that even if DMSO was present, it couldn't have converted into DMSO4 naturally. The chemical pathway required much higher heat and catalysts that weren't present in the ER. Skeptics proposed alternate explanations. One idea was that fumes from medical equipment, particularly the blood-drawing syringes or sterilizing agents, might have mixed with oxygen, producing a short-lived toxic compound. Another theory pointed toward contaminated intravenous lines or medications. But none of these possibilities were ever proven.
Evry test cam bac négative.
Meanwhile, the victims of the incident, the doctors and nurses who fell ill, were left frustrated.
Docteur.
Julie Gorczynski, who had collapsed early during the resuscitation, suffered lasting effects. She experienced chronic bone pain, avascular necrosis, and months of fatigue. The hospital initially dismissed her symptoms as stress-related, but medical scans confirmed tissue damage consistent with chemical exposure. The controversy deepened. Some medical staff accused the hospital of a cover-up, saying administrators wanted to avoid lawsuits or public panic. The hospital, in turn, claimed the staff had overreacted and that their illnesses were psychosomatic. It became a scientific stalemate, two sides of the same event with no middle ground. By mid-1995, official reports closed the case, stating that Gloria Ramirez died of complications of cervical cancer, and that the illnesses of hospital staff were caused by fumes released from an unknown chemical. The file was marked unresolved. But the mystery refused to die. Independent journalists, chemists, and amateur investigators continued digging. Some pointed out that the mass hysteria explanation fit the timeline. Once the first nurse fainted, others panicked and felt sick. However, that still didn't explain the crystals seen in Gloria's blood or the ammonia-like odor during the autopsy. Others speculated Gloria might have been exposed to illegal chemical manufacturing before being admitted, perhaps through contaminated drugs or solvents. A few fringe theories even suggested she had been part of a secret chemical test or industrial accident that was quietly contained by authorities. None of these claims were ever verified. What is certain is this: multiple medical professionals fainted and fell ill that night. A strange odor and oily residue were undeniably present. No definitive chemical was ever identified. Even decades later, toxicologists and ER physicians still debate the event. It's now a case study in medical training programs, both for chemical hazard preparedness and for understanding the limits of scientific investigation. In April 1994, after weeks of legal delays, Gloria Ramirez's body was finally released to her family. They buried her in a simple grave at Olivewood Memorial Park, Riverside. Her husband and children continued to demand a full explanation, but none ever came. The public gradually moved on, yet the name Gloria Ramirez became permanently linked to one haunting question: how could a dying woman become toxic to everyone around her? No clear answer has ever been accepted. The case remains open-ended, half science, half mystery. To this day, the Toxic Lady incident stands as one of the most bizarre unsolved medical puzzles in U.S. history. There was no virus, no radiation, no crime. Just an ordinary woman whose final moments triggered an extraordinary event that defied every logical explanation. If the Livermore scientists were right, then this was a tragic accident, the unintended consequence of chemistry gone wrong. But if they were wrong, then the truth of what really happened inside Riverside General's ER on that February night may never be known. Gloria Ramirez's story is a reminder of how fragile the boundary is between science and the unknown, and how even in the most controlled environments, nature can still surprise us in ways we can't predict or understand. The Toxic Woman case closed with no conclusive cause, no one held accountable, and no one truly satisfied. And so, nearly 30 years later, it remains exactly what investigators called it from the start, an unsettling mystery.